Positioning the operator and the equipment. There are two main operator positions for the performance of the obstetric ultrasound examination, standing or sitting. The standing position minimizes pressure on the operator's shoulder and elbow and maintain the shoulder joint in an adducted position. It is somewhat uncomfortable for a long examination. This is how to place the probe, and this is either you sit or you stand when you're scanning a patient, and you close the patient to the ultrasound machine very well. This is another image how to scan when we are scanning the patient. You should always make sure that the cable of the probe is very long so that you're able to to take your hand to all the necessary parts of the patient. The settings position allow for more comfort during the examination, and it is also a better station from which to manipulate the keyboard on the ultrasound machine. In the sitting position, it is criteria to ensure that the chair is higher enough and the table is at the lower level in order to minimize reaching over the transducer and to allow for minimal adduction of the operator shoulder joint during scanning. When performing an ultrasound, keep your eyes on the screen as perpendicular as possible in order to avoid perception and distortion artifacts, especially with newer ultrasound machine monitor. This is what they are talking about. You keep your eyes straight to the ultrasound machine, and you make sure your left hand is on the machine so that you not allow artifacts and distortion to occur when you are scanning. All transducers have a mark notch that distinguish one side from the other. In holding the transducer transversely, the marker of the transducer should be on the patient's right side, and if the transducer is held in a longitudinal orientation, the marker should be towards the uterine funda, patient's head. The transducer cable should be supported in order to provide minimal pull, eliminating dragging during scanning. Check that the cable is not too rigid, which might interfere with the ease of transducer manipulation. So when you are scanning, the cable must be long enough and will not be pulling up and down.